welcome. I'm so happy to have Dara here with me. Welcome to our Wednesday night Facebook Live.
Yes,
And I brought Dara in because what are we going to be talking about today, Dara?
we are going to be talking about estrogen
Mhm.
and how it affects you through perimenopause.
Yeah, so I was recently exposed to this article that was sent to me about the musculoskeletal syndrome of menopause. So many of us are aware, females, we're aware of like the vaginal GU symptom, genital urinary symptoms associated with menopause. So the vaginal atrophy, the sometimes painful intercourse, increase in UTIs, and that is specifically called a syndrome called the genital urinary syndrome of menopause. But this just recently came out that they are now recognizing that there is a musculoskeletal syndrome associated with menopause as well. And I can tell you that this is really a big breakthrough because women have been complaining about this for years, but there's never been a recognized actual syndrome associated with it. And this article just comes out and talks all about it. So it's been really good. So, what are your thoughts? I sent you the article. What did you think?
I thought it was really good. I'm not at that stage in my life, but I am around all ages of women, and I've heard them say that same thing and the same thing. And then when they say something to their medical professionals, usually not much is done with
Hmm.
that.
Hmm.
And I think that there's just hasn't been a lot of education. And so this article is very exciting because it's going to give people options, and it's going to, it sometimes feels nice to have a name to the issue.
Hmm.
And then you kind of know this is how we need to proceed. This is how we need to, go forward with helping this issue.
And so that we don't feel like we're crazy. So I also
Yes,
am not in
yes.
that postmenopausal stage, but I do take care of obviously a lot of women who are. And just for
Mhm.
some data, just for some statistics, because I really like statistics, it's estimated that more than 47 million women every year enter menopause across the world.
Mm.
That is not a small population. That is a large population. And that up to even over 70% of these women will experience some kind of musculoskeletal symptom. So we're
Yeah.
talking about musculoskeletal symptom. We're talking about pain. We're talking about decreased bone density, loss of muscle mass, progression of osteoarthritis, so many different things. And the stats also show that up to 25% of them will be disabled by these symptoms throughout this transition. And that is overwhelming. If 25% of 47 million people, I can't do that math, like 12,
Yeah,
like
it's not my
12,
strong suit.
12 million people or something, women every year are disabled by these symptoms.
Yeah.
And,
Well, and
you know,
early too. Like, think
yeah,
about the age at which women tend to go through menopause. It's like that you're young. You
yeah,
have maybe half your life, or hopefully more than that,
yeah,
left. That's
yeah.
a long time.
The average age is anywhere between 45 to 55, but can start earlier and can
Hmm.
start later. But it can also, if you think about it too, menopause, you can also be put into a surgical menopause if you have a hysterectomy with or without the ovaries being taken out. That will
Yeah.
also affect your hormones. So there are a lot of women who are put into menopause early surgically because of, for some reason or another, they need to have their uterus taken out.
Yeah.
But what's really interesting is about these women will come to their providers and let them know, hey, I have pain. I just, I'm not able to do what I used to do. I can't pick up my child anymore or my grandchild. I hear a lot of women have foot pain. That's a big thing I hear, and plantar fasciitis or whatever it may be. And there's nothing a lot of them do, and they find nothing on diagnostic imaging. There's no structural findings for about 40% of these women. They find nothing on diagnostic imaging. So they're just kind of pushed away and just said, okay, well, that you're just, maybe labeled a chronic pain or maybe put in a boot for a while or,
Hmm.
hopefully most of these women are still able to function. But if you think about it, if you have a job where you're on your feet all the time, this can be debilitating. It can
Yeah.
really change your life.
Yeah.
Um,
And then to
so
be told this is just your new normal. This is
yeah,
just your new normal. This is just what it is now, now that you're postmenopause or
yeah.
perimenopause. So that it's frustrating. That'd be very frustrating.
Absolutely. So we want to bring to light that it is not in your brain, only in your brain. There is something going on with you, whether or not they can find it on imaging. There is something going on with you, and it does have to do with menopause, perimenopause, and what's going on through menopause. So the average onset of perimenopause is about 47 and a half years, and you'll go through that for about anywhere between 2 to 10 years. You'll go through that. But one of the big things with the musculoskeletal symptoms is this decline in estradiol, or which is the most biological active form of estrogen. And this is what Dara was talking about. So did you realize how much estrogen was important for all of these bones, muscles, tissues?
I mean, I'm sure I read it at some point, but I kind of just forgot about it. And I was like, oh, this is so exciting because estrogen is constantly getting hated on.
Yeah.
But it's so important and it's so vital for our health and well being and for, anti inflammatory effects and just so many things. So, yeah.
This type of estrogen, the estradiol, affects nearly all types of musculoskeletal tissue, including our bones, tendons, muscle, cartilage, ligaments, and our adipose, our fat. There's 5 primary changes that are associated with this loss of estrogen throughout menopause. And one is an increase in inflammation. Inflammation, well, we all know how bad inflammation is, but estrogen is an anti-inflammatory and can really help calm down that inflammation and help prevent pain, the generalized muscle pain that you have, whether you hurt yourself or whether you're working out or just, the aches and pains of daily living. Estrogen is helping to keep that at bay. And when we start to lose that estrogen, you'll start to have pain associated with it. And you will have an increase in inflammation, which, by the way, is a precursor for chronic diseases.
Yeah.
So that's one of the big changes. A second change is decrease in bone mineral density. And that is huge. That leads to osteopenia and osteoporosis. And for those of you who don't know, that is a huge comorbidity for postmenopausal women. Estrogen, but also testosterone, has a big impact on your bone health. And that's why I'm always pushing, and I know you are too, resistance training is super important for menopausal, perimenopausal, postmenopausal women specifically. What does resistance training do for the bone density?
It helps to increase the bone density. And it also, well, I could just go on about it forever, but it's gonna give you more bone density. It's gonna give you back that strength that you're losing in perimenopause. It's gonna help to halt all of these issues that you're having, or reverse, depending on how far along you are.
Yeah. Another big change with that lack of estrogen is called sarcopenia. And sarcopenia is an age-related loss of lean muscle mass and atrophy of the muscle. And I know we all see that. We see people who are older and they just get thinner and more frail appearing. And then what can't they do? They can't get up from a chair without rocking a few times, right? That's actually something we measure in healthcare, is how many rocks does it take for them to get up out of a chair? Can they open a jar? That's another sign of aging, is if they're able to grip and open a jar. And this sarcopenia is greatly associated with lack of estrogen, but also the lack of resistance training. And then some certain nutritional things, such as adequate protein intake, vitamin D, and even creatine can be helpful with that. So definitely important with when it comes to muscle mass.
Yeah, absolutely.
There's go ahead.
No, I was just going to say, as we were talking about the mineral stores and how mineral deficiency, it's like 10%, you were talking about loss. And I just think about that in my own life. I know that having so many pregnancies, how depleted your body is from pregnancy. And it's hard to, gauge just how deficient you become, but some people have estimated that you lose up to 10% of your mineral stores in a pregnancy. And so then it's like, if you start off that way, if you had multiple children and you are at a mineral deficiency then, and then you're going into this next stage of life and have additional mineral deficiencies, it just sets us up for really, for a struggle.
Yeah, like you said, there is an average reduction of about 10% in bone mineral density loss through menopause. And then what's really remarkable is women have a reduction of 0.6% in muscle mass per year after menopause. That's per year. So that compounds very quickly.
Yeah.
So it doesn't take you long to be very deficient in your muscle mass. And again, I go back to women who go into surgical menopause early because for whatever reason. So the earlier you start menopause, the worse this is for you. So just
Yeah.
something to keep in your mind is that it's really important to protect that.
Mm-hmm.
Sorry, my throat
Absolutely.
is dry. Another thing that estrogen is really important in is called satellite cells. So these satellite cells or these stem cells are located on the muscle fibers, and what they do is they promote plasticity or the ability to move and regeneration of the muscle. So when you think about this, you're thinking about the ability to rebuild your muscle after a workout or after surgery or after whatever injury you have towards it. There is some research that says compared to premenopausal, postmenopausal, this was in mice, were found to have about 60% fewer satellite cells. So that is specifically really working on their legs and their hips. And so a lot of postmenopausal women will have back pain, hip pain, lower leg pain. And that's a lot of that can be related to the decrease in satellite cells. That also in conjunction with the decrease of muscle mass and the decreased bone density, it just compounds that problem so much more.
Yeah.
When we're talking about the bone density, there's statistics of 70% of hip fractures occur in women.
Mm-hmm.
That is ridiculous. So
Mm-hmm.
that is a huge amount of people. And coming from a healthcare professional point of view, a hip fracture can be life changing, life altering, and even deadly for some people.
Mm-hmm.
Um, we think about it, in our young brain, but an older person who falls or even sits wrong and gets a hip fracture, they may never walk again.
Mm-hmm.
And they may end up in a nursing home or and anytime you're bedbound or not able to move, there's all those complications associated with it, including like blood clots and again furthering the muscle mass loss and that type of thing. And this is funny to think. Two people like, oh, my mom always jokes about she throws out her back when she sneezes, but I have seen several older people who will have a compression fracture or a rib fracture from doing something simple like sneezing or moving a wrong way or sitting for a long period of time.
Mm-hmm. It
It's
is
just not
crazy to think about.
it's just not something that can be taken lightly because it can be really painful for one
Yeah.
and can really impact your life.
Yeah. I feel like in my own experiences, um, it seems like when people fracture their hip, it feels like it's the beginning of the end because it is so serious. It's,
Hmm.
that's what kind of sets
Hmm.
off these cascade of other events. Um, and so, yeah, it's a big deal, especially for us women.
Yeah. The last key role that estrogen plays in our musculoskeletal system is cartilage. And cartilage is just this dense matrix and is partly regulated by estrogen. So when that estrogen goes away, and when I say go away, most postmenopausal women have zero estrogen, zero. Um, you have more pain, more arthritis, and the studies are showing that women experience more debilitating arthritic pain than men, likely because of that reduction in estrogen that's so big that women they experience as they go through menopause. So lots of things, lots of different reasons why estrogen and the lack of estrogen impacts your musculoskeletal body, part of your body. So different things we can do. We talked about this resistance training, resistance training, resistance training. I'm big on that. You
Mm-hmm.
really got to make sure you're lifting.
Yeah,
And as we
absolutely.
go further, Dara and Mike are going to be sharing videos, different exercise tips, things we can do in our actual like day to day life. If you have a desk job, or if you can't get out, or if you're more limited in what you can do, or you don't go to a gym, they're going to provide some tips and show some exercises that are really great to help with that. A simple thing I tell people: get a band.
Mm-hmm.
That's
Yeah,
resistance training. Just get a
yeah.
band and do some simple exercises. But
Mm-hmm.
we'll be providing more information on that just because we're such big believers in resistance training.
Yeah.
Again, vitamin D, super important. I check that on all of my patients, every single one of
Mm-hmm.
them. Most people, they want to know what's an optimal vitamin D level is 60 to 80. So I don't care if it says normal range is 30 to 100. I want them at 60 because there's some protection against different cancers. Once you hit that 60 marker, I talked about that a few weeks back. You can take a look at that, but proper vitamin D, calcium can be really important. And K2, super important. K2 helps to bring that vitamin D into the bones. And again, we know we need it in the bones to help keep that bone density in there. Other things, go ahead.
I was just gonna say, what about magnesium? I feel like magnesium was one that was supposed to also play a key factor in helping with this.
Magnesium is super important as well. It helps to for all the hormones to work well and helps to really metabolize things sufficiently with your thyroid and parathyroid. So it really can be helpful, especially with the muscle side of things versus the bone density.
Yeah. Okay.
Good nutrition. So again, sufficient protein. We're very protein deficient in this, especially older people. They just don't eat a lot of protein. It's really important to have enough protein to keep that muscle mass. And then, of course, we're big proponents for the right population to be on hormones. Hormone replacement therapy can protect your bone, your brain, your breast, your heart, your relationship. I mean, it can be very protective for several different things. So those are all different things that we talk about. Big proponents of bioidentical hormones. Again, bioidentical is what EIP does because we don't want that synthetic in your body. So just to put that out there, we are doing a couple of seminars in the next week actually to talk specifically about hormone therapy. One tomorrow in Winfield. You can check out that information on our Facebook site and on our website. No need to RSVP, just show up. And then one on Tuesday in Rochelle. And both of those will be free to the public. There's going to be deals offered. I'll be there. Obviously, I'm going to be talking more in depth about hormones and weight loss, but be there to help with questions that you have. And my staff will be there as well. It's really a good time to come actually just experience things and really learn more about it. Both Dara and I are hormone. We're big proponents of hormones in our families as well. So it's really been life-changing, I think. So for me.
Yeah, absolutely.
But lots of different things we offer here. So if you keep an eye out for more Facebook Lives coming about nutrition and about exercise, Dara and Mike are great resources for different exercises, how to exercise and protect your body when you're exercising and how to do it right and how to make the most of it. Nutrition, we're talking about hormones, we're talking about all kinds of things. We're going to be here every week at Wednesday at 6:00 with a new topic, and then you can always go back and look at the old topics. But we want to just bring education to you, just to hopefully you can glean some words of wisdom and bring it into your life and help change your life, change the way you age for sure.
Great.
All right, you guys. Well, it was good seeing you. We will talk to you next week.
Thanks, Angie.
Bye.